I've simulated putting on my PPE. Is the scene safe?
Scene is safe.
What is the mechanism of injury or nature of illness?
You've been responded to a call for a male experiencing chest pain.
Just one patient?
Yes.
I'd like to request ALS at this time.
ALS is now en route.
Is there any reason to suspect a spinal injury, any trauma?
Not at this time.
Okay. What is the general impression of my patient?
You've arrived to find a gentleman sitting in his living room experiencing chest pain in moderate distress.
Okay. Does the patient track me as I walk in the room?
Yes, he does.
So the patient appears to be awake and alert. I'd like to determine orientation. Hi, sir. My name is Chris. I'm an EMT. What's your name?
Hi, Chris. I'm George.
Hi, George. How old are you, sir?
I'm 57.
All right. And do you know what city you're in right now?
Yes, I'm in Simi Valley.
And who's the president?
President Trump.
And what seems to be going on today? Why did you call us?
For this chest pain I have right here.
All right. So a 57-year-old male complaining of chest pain. So chief complaint is chest pain. I'm going to assess the airway. It appears from the patient talking to me that the patient has a patent maintainable airway that does not need suctioning. I'm going to assess the respiratory system and see if it is adequate. I'm looking for rate, rhythm, and quality.
His breathing is adequate and within normal limits.
Okay, adequate in normal limits. And a pulse ox for the patient?
His pulse ox is currently 95% on room air.
Okay. So with a 95% on room air pulse ox and a chief complaint of chest pain, I am not going to initiate any oxygen therapy since the patient's pulse ox is above 94%. I'm going to be looking at the circulatory system now. First thing I want to know is there any major bleeds?
None seen at this time.
Okay. And I'd like to check their pulse. I'm looking for the rate, the rhythm, and the quality.
Pulse currently is going to be irregular. It is weak and is approximately 60.
Okay. And his skin signs.
Skins are currently pale, moist, and cool.
All right, due to the fact that the patient has chest pain with skin signs that are pale and cool, I'd say the patient is a priority patient for transport. And at this time, I'd like to start doing my OPQRSTs. So, sir, what were you doing when this pain started?
I was just watching TV.
Okay, just watching TV?
Yes.
All right, you weren't doing anything strenuous?
No, sir.
All right. And can you describe the pain to me?
I would say it's a sharp pain right here. Center.
Okay, sharp pain, center of the chest?
Yes.
Does it go anywhere?
A little off to the shoulder here.
Okay, so sharp pain in the middle of your chest and it radiates to your left shoulder.
Yes.
And how bad would you say that pain is on a scale of 1 to 10? 10 being the worst pain you could imagine and 1 being the bare minimum pain you could imagine?
I'd say it's an 8.
About an 8. All right. And how long has this been going on for?
About 30 minutes.
All right. Does anything make it better? And does anything make it worse?
No. I took a nitro and thinking that might help. I take that for angina and that didn't help.
Okay. And how long ago did you take the nitroglycerin, sir?
I took it about 10 minutes after it started.
All right. So it started about 30 minutes ago, so that means you took the nitro probably about 20 minutes ago. It sound
Yes.
about right?
Yes, that's about right.
All right. So looking at a sample history, signs and symptoms, we have pale, cool skins with chest pain. Sir, do you have any allergies?
I have no allergies to medications. No.
All right. And what medications do you take? You said you take nitro.
Yes.
What else do you take?
I take lovastatin. I take atenolol. And then I take one for diabetes, and I forget what it's called off the top of my head.
Okay. So looking at that list of medications, it looks like you have a history, you said, of chest pain in the past.
Yes.
And you have a history of high cholesterol.
Yes.
And a history of high blood pressure.
Yes.
And history of diabetes.
You're correct.
Anything else?
No.
All right. And the last time you had anything to eat or drink?
A A couple hours ago, I had a sandwich for lunch.
All right, and then the events leading up to the current situation, you said today you haven't been doing anything strenuous, just watching the TV?
Correct. Just watching
Alright.
TV.
All right, and for my secondary assessment, I would like to look at the cardiovascular system primarily and rule out some other things just to ensure that it is related to it. So, sir, the first thing that I would like to do is I'd like to push on your chest and see if there's any additional pain when I push on it.
No.
Can you take a deep breath for me? Is there any additional pain when you take a deep breath?
No.
Do you have any shortness of breath?
No.
Any nausea or any vomiting?
No.
All right, and no fainting? Haven't felt like you need to faint at all today?
No.
All right. Okay, at this time I'd like to take the patient's vital signs. I do have my blood pressure cuff and stethoscope. So is it okay if we roll your sleeve up?
Sure.
All right. Should be good. For the blood pressure, I got 106/70.
Okay, for the scenario, we're going to go ahead and go with a 160/100.
Okay, 160/100. All right, I'm going to take the patient's pulse rate.
Pulse is currently 60 and irregular.
Okay. And the current respiratory rate.
Current respiratory rate is 14 with
Okay.
adequate tidal volume.
All right. Looking at all the questions that we asked, it appears that the patient is having a form of a cardiac event, some kind of coronary event, and I would like to administer some nitroglycerin, but before I do, I want to ask the patient a couple questions. Sir, have you only had just the one nitroglycerin today?
Yes.
Okay. Have you had any sexually enhancing medications?
No.
All right. And do you have the medication with you?
Yes.
Okay. Patient hands me the medication. I'm going to do my 6 rights D nice. I want to make sure that this is the patient's medication. Sir, this is the medication you're prescribed by your doctor?
Yes.
Okay. I want to make sure it's not expired. Does not appear to be. Okay. I'm going to open it up. I'm going to give the patient 1 pill. Sir, if you can just place that under your tongue. Okay. I'm going to note the time that the patient administered it. And I'm going to wait approximately 5 minutes. And I'm going to see if that makes any difference in the patient's discomfort. So after 5 minutes have passed, sir, has that changed your level of pain at all?
About a 7.
Okay, so it's come down a little bit from an 8 to a 7.
Paramedics have now arrived.
Okay, so I'm going to pass this along to our paramedics who have arrived on scene. We currently have a 57-year-old male whose chief complaint was chest pain. Upon our arrival, the patient's skins were pale, moist, and cool. The patient describes the pain as a sharp pain in the center of his chest that radiates to his left shoulder. This pain started while the patient was watching TV, no exertion. The patient described the pain as an 8 out of 10 on the pain scale and said it started approximately 30 minutes prior to contacting us. He stated he took a nitroglycerin approximately 10 minutes after it started. which would have put it about 20 minutes prior to contacting us. The patient has no known drug allergies. The patient does have a history of chest pain, high cholesterol, high blood pressure, and diabetes. He does take the following medications: lovastatin, atenolol, an unknown diabetic medication, and the nitroglycerin. He said that his original vital signs for us was 160/100. His pulse was 60 and irregular. His respiratory rate was 14 with adequate quality. The patient was assisted with administering 1 additional dose of nitroglycerin sublingual, and that did bring the pain down from a 7 to from an 8 to a 7. I have not had a chance to reassess the second set of vitals. Would you like me to do that at this time?
No.